Hi friends, welcome back. So if your BP is more than 160 by 100, you don't have a high BP. You have stage 2 hypertension and 90% of the medical students fail in this. Stay with me for a few minutes. I'll give you 3 Viva traps that professor would love. See this later. JNC 8 uses 4 steps that are normal pre-hypertension stage 1, stage 2. But here's the trap. Cutoff changed in 2017. Your textbook says 140 bar 90. Your USMLE says 130 bar 80. Which one will your professor ask? I'll tell you at few minutes. Don't skip. So step 1, if you see in normal, it's less than 120 bar 80, like 115 bar 70, we have a chill patient over here. So the step 2 is pre-hypertension, where it ranges from 120 to 139 bar 80 to 89, like 130 bar 86, which is saying the warning sign. The JNC 8 causes pre because 40% of the pre-hypertension becomes stage 1 in 4 years. So here's the Viva trap 1. Is prehypertension a disease? The answer would be no. It's a risk category. But you must start the lifestyle changes here. Comment pre if you knew prehypertension isn't a stage 1. Let me check it. Then comes the step 3, where the stage 1 is either 1 to 140 to 159 bar 90 to 99. For example, 150 bar 96. Here the headache starts. So JNC 8 says if BP is 140 to 159, it conforms on 2 plus visits. But if it's more than 160 per 100 and 1 visit, the diagnosis confirmed immediately. Then comes to step 4, that is the stage 2, where it is more than 160 by 100, example 170 by 105, where it called as the red crisis. Wait, why is your senior saying that 130 by 80 is hypertension? Because ACC on 2017 lowered the cutoffs. So within few minutes, I'll show you a one-line answer that works for both JNC 8 plus ACC. So JNC diagnosis rule, we have 3 things. That is, first one is the correct technique, where 5 minutes rest, correct cut the both arms within first visit. Then comes the average of more than 2 readings with the 1 minute apart. Then comes the average of readings on more than 2 separate days. Here comes the Viva trap number 2. Can we diagnose hypertension in one day? The answer will be only if it is more than 160 by 100. Otherwise, no. So here is the one-line Viva answer. As per JNC 8, hypertension is more than 140 by 90 mmHg, but ACCHA from 2017, it revised it to more than 130 by 80 mmHg. However, JNC 8 is followed in India, where the professor nods and you will get the full marks. Now comes the Viva trap 3. What is white coat hypertension? Which is a high in clinic and normal at home. You should always mention that HPPM bar ABPM to confirm. So add this line to your exam so you'll get the extra marks. Now we'll go for a recap. The normal will be less than 120 bar 80. The pre-hypertension is 120 to 139 bar 80 to 89. The stage 1 will be 140 to 159 bar 90 to 99, where the stage 2 is more than 160 bar 100. And we diagnose as 2 readings, 2 days. If this saved your Viva, save plus share with your pharma group. The next video will be soon in the channel. I'm Shifana. See you in Zen with Shifana. So breathe first and take a checkup of your BP.